What's up everyone, my name is Dr. Sagar Patel and I'm a facial plastic surgeon here in Beverly Hills. What we're talking about today is an amazing surgery called buccal fat removal. This is a cheek reduction surgery, so if you've ever thought you had chubby cheeks or round face, watch this video to learn more. So first of all, what is buccal fat removal? Buccal fat is a fat we're all born with. Now there's two different types of fat in the body. Brown fat and yellow fat. Yellow fat is the fat that as you gain and lose weight, it's gonna get bigger and smaller. Brown fat, on the other hand, is a fat that we're all born with. It's baby fat, it's embryologic fat that's there for different reasons. It's there for protection, to help with a baby sucking their cheeks, and it's there because it burns at an even higher caloric content than regular fat. Unfortunately, this also means it's the very last fat in our body to burn. So despite how skinny you can get your body, until you get to a very ketogenic state, you're not going to be burning buccal fat in the same way. The factors that go into how buccal fat is lost include age, genetics, but mainly your gender. Now, ethnicity plays probably a larger role than it's ever imagined. If you're Asian, Hispanic, or Black, you're gonna find that for the most part, you're gonna hold on to the fat a lot longer than someone who's Caucasian. Now, everyone is eventually going to lose this fat, but at the same time, if you want to reduce that fat beforehand, then buccal fat removal might be the right surgery for you. The next question is, what does buccal fat removal do? How can you simulate what it'll look like? And the first answer to that question is, it's not by sucking in your cheeks. What you'll notice is it really is a cheekbone enhancement surgery. We want to be able to see different areas of contours and concavity in our face. When you look at someone who's a supermodel, for example, and you ask where is their cheeks, you usually circle the cheekbones. What we want when we think of cheeks is high cheekbones, not a full face below that. Now, as much as we can build a mountain, we can also dig a valley. Doing something like fat grafting or fillers to the cheekbones themselves will help enhance your cheekbones, but we can also enhance them by identifying where they're located by removing the buccal fat, help define that area below it. And if I were to tell you the best way to simulate it, it would be if you put on contouring when you're using your makeup on your cheekbones and you love the way it looks, then buccal fat removal might be the surgery for you. How is buccal fat removal done? Well, that's the beauty of it. This procedure is most similar to a dental teeth cleaning type procedure. There's some discomfort when we numb you, some discomfort during surgery. You're really limited for activities for the first week. Overall, I tell people I don't want you working out, I don't want you smoking, I don't want you drinking, and I don't want you using a straw for a week. But the stitches that we put in dissolve on their own. The average person, when you go to an expert in buccal fat removal, doesn't get that swollen. So anybody around you can't tell the very next day you had surgery. Now, when it comes down to it, the recovery is overall easy after that first day. I recommend you ice and take pain pills, and the next day you pretty much should be able to go back to work. What are the downsides of buccal fat removal? So first of all, not everyone's a candidate. If you have a really skinny face to begin with, or propensity as you age to not be able to hold on to fat in your face, you might want to reconsider it. Look at what your mom and dad look like as they've aged. Ask them if they had fuller, rounder cheeks when they were younger, and perhaps you'll find that if you wait a little bit more time, your body will start dissolving that brown fat on its own. Now, it's important to go to someone who does a lot of buccal fat removals. Think 5 to 10 per week. It's a simple surgery, but your analysis, your consultation, your expectations, and most importantly, your results are gonna be dependent on going to a surgeon who does this surgery a lot. And there's really not that many of us. Honestly, 5 to 10 in the United States of people who really do a lot of buccal fat removal surgeries. How much does buccal fat removal cost? Well, this surgery, like I said, because it's simple, you can get it done really cheap or you can pay a lot for it. My price is right in the middle, and overall, if you want to go to Mexico, feel free, but remember that complications can happen with every surgery and surgeon. It's important that you're in board certified hands and someone who knows how to take care of you. Does buccal fat removal hurt? In the end of the day, buccal fat removal is fairly painless. I recommend you take pain pills that first couple of hours after surgery, ice your cheeks. The next morning when you wake up, you should feel pretty good and be able to walk around, talk around, and essentially do whatever you want. How do I know if buccal fat removal is the right surgery for me? If you want to know if buccal fat removal is the right surgery for you, call our office, schedule a consultation, Make sure that we know all of your history, what your goals are, and we'll go through that. I don't really need to see you in person because it's really easy for me to assess the contours of your face through pictures and FaceTime, and feel free to reach out to schedule that consultation. Please like, subscribe to this channel, and if you have any questions, please leave a comment below. Talk to you guys later.